Hello everyone, my name is Kay, a registered nurse, and today I'm excited to present an evidence-based care plan designed to enhance the safety and outcomes of a 35-year-old female patient with symptoms of restlessness, excessive worry, anxiety, and difficulty concentrating, and diagnosed with anxiety. I will also walk you through how I developed this plan using an evidence-based practice model and share the evidence that was most influential in my decision-making process. Finally, I'll discuss the benefits of remote collaboration in healthcare and explore strategies to mitigate challenges that often arise in a remote, interdisciplinary setting. So for our patient overview, our patient is a 35-year-old female suffering from anxiety, a condition that not only affects her mental well-being, but also has the potential for physical health implications if left unmanaged. The goal of our care plan is to provide a holistic approach that addresses her anxiety symptoms, improves her quality of life, and ensures her safety throughout the treatment process. To develop this care plan, I utilized the Johns Hopkins Nursing Evidence-Based Practice, or JHNEBP model. According to the Upstate Medical University Health Sciences Library, this model is highly effective for integrating clinical expertise, the best available evidence, and the patient preferences into our care approach. Basing it off on our EBP model, our step 1 would be identifying the practice question. Our practice question is, how can we improve the safety and outcomes of a 35-year-old female patient with anxiety through an evidence-based care plan? Step 2 would be gathering and appraising evidences. I conducted a comprehensive literature review utilizing the Capella University Library, Summon, PubMed, and the National Institutes of Health, and utilized peer-reviewed journals and government websites and agencies. I narrowed down my research from 2019 to 2024 to focus on recent studies from the past 5 years. The key findings from research authored by David Papola, Clara Miguel and Associates, and published in the Journal of the American Medical Association in 2024 show that cognitive behavioral therapy, or CBT, is still one of the leading treatments for anxiety and is associated with long-term effectiveness. Multiple studies highlight CBT as a first-line treatment for anxiety. It's shown to significantly reduce symptoms and improve coping mechanisms in patients with anxiety disorders. Then we have the pharmacotherapy. A study authored by Amber Edinoff, Hasib Akali and Associates claims that evidence supports that the preferred pharmacological treatment for anxiety disorders at present is the SSRIs, or selective serotonin reuptake inhibitors, due to the significant amount of literature that supports their safety and effectiveness. Next, we have the mindfulness-based stress reduction, or MBSR. Dr. John Kabat-Zinn developed the program, and according to the Department of Mental Health and Addiction Services in the state of Connecticut, MBSR is a well-known Western clinical adaptation that can be a valuable adjunct to traditional therapies, helping reduce anxiety symptoms and improve overall well-being. And then lastly, we have lifestyle modifications. In 2022, United Healthcare published an article regarding lifestyle changes that can aid manage depression and anxiety. Regular physical activity, a balanced diet, a proper sleep hygiene are all supported by evidence as contributing factors in reducing anxiety symptoms and improving patient outcomes. Step 3 in our evidence-based model would be the making practice decisions. Based on the evidence-based practices I gathered, I am proposing a comprehensive care plan that includes 1. Cognitive behavioral therapy, or CBT, pharmacotherapy, initiating low doses of SSRIs, mindfulness-based stress reduction, or MBSR, and lifestyle interventions. Now let's talk about the most impactful evidence The most impactful evidence came from the randomized controlled trials, or RCTs, that demonstrated the effectiveness of CBTs and SSRIs in treating anxiety. The research performed by Dr. David Popola and Dr. Maria Cristina Mazzaglia and Associates in 2024 performed a systematic review and network meta-analysis, which resulted in an overwhelmingly positive association of CBT's intermediate and long-term effectiveness to patients with anxiety. Based on their research, which involved 65 randomized controlled trials and 5,048 participants, CBT could be considered as the primary treatment for generalized anxiety disorder. And in conclusion, the combination of these approaches has been shown to yield significant improvement in patient outcomes, making them central to our care plan. So what are the benefits of remote collaboration? In 2019, a journal article authored by Dr. Sekhar Swar, Dr. Bikash Gopchan, and Associates was published in Psychiatry Online and discussed remote teleconsultation in a rural town in Nepal. The journal emphasized how remote collaborative care was a significant intervention in addressing mental health concerns in underserved areas that lack health resources. Remote collaboration utilizes web-based shared clinical records to facilitate communication between rural primary care teams and a specialized or centralized mental health team. Patients were monitored by telephone, and psychiatrists provided remote supervision through the web-based shared clinical records or telephone. Remote collaboration allows healthcare professionals to bring diverse expertise together, regardless of geographical barriers. It also enables continuous communication, flexibility in scheduling, and the ability to provide care to patients who may have limited access to in-person activities and services. Despite the benefits, there are still challenges with remote collaboration. Some of the challenges include communication barriers, time zone differences, and the potential for reduced team cohesion, and the risk of breaching patient health information, or PHI, due to the technological challenges and breaches. In 2023, an article from the Online Journal of Issues in Nursing, or OJIN, authored by Dr. Karen Speroni, corroborated the younger generation of healthcare members are armed with higher technical aptitude and redefined standards for improving remote work processes in a modern context. However, the top barriers discussed in the article were the sense of disconnection from colleagues and supervisors, the absence of close personal connections, and lacking regular communication with coworkers, and ultimately diminished sense of teamwork. Some nurses found it challenging to discern relationship dynamics during online interactions, especially when they were the sole participants in a remote call while others were physically present in a meeting at a hospital. To mitigate these challenges, the following strategies are recommended, including clear communication channels, regular team meetings, defined roles and responsibilities, and cultural sensitivity and awareness. In conclusion, the evidence-based care plan we've proposed, grounded in the JHNEBP model, is designed to significantly improve the safety and outcomes for our patients and future clients with anxiety. The integration of CBT, pharmacotherapy, MBSR, and lifestyle modification offers a comprehensive approach tailored to our patients' needs. Remote collaborations across different disciplines offer several benefits when providing mental health care, enhancing the quality and the accessibility of care for patients. Remote collaboration allows mental health professionals to connect with experts from various disciplines such as psychiatry, psychology, social work, nursing, and primary care. The interdisciplinary approach ensures the patients receive comprehensive care that address all aspects of their mental health. including psychological, medical, and social needs, even in rural areas with insufficient health resources. By implementing these strategies to overcome communication and collaboration hurdles, we can ensure that our patient receives the highest quality of care regardless of her physical location. Thank you for your attention, and again, my name is Kay Winston. It's been a pleasure having you here, and I look forward to any questions you might have. Thank you.